Hi there and welcome to this month's Team Brief podcast. Today I'm in the Occupational Health Department about to have my annual flu vaccination. It's that time of year again when flu starts doing the rounds, and we're urging all of you to make sure you have your vaccination. It's so important that you have the vaccine because the flu can make you extremely unwell, and for some it can lead to chest infections, severe complications and even death. Please protect yourself, your families and our patients from the flu, and the best way to do this is to have your flu jab. The flu clinics begin next week. There will be vaccination sessions in the Charters restaurant, and jabbers will be going around the wards and departments to make it easy and convenient for you to have your vaccination. Visit the flu intranet page to find out when and where you can have your jab. There are prizes up for grabs too for the person who has given the most vaccinations, and also everyone who receives the jab will be put into a prize draw. So I'm having my jab right now, and this is Trish Driver who's going to give me my injection. Apparently it doesn't hurt at all.
Are you fit and well today?
I am.
Yeah. Have you had the vaccine before?
I have.
Yeah. Any problems when you had it before?
No, nothing at all. No problems.
You've no allergies at all to anything?
No.
No health or medical conditions that might impact on the vaccine?
Not
and you've signed your consent form?
I did.
Yeah. Did you read the information on the back of the form?
I did.
Yeah. Any questions about it?
No, again, I think the only thing I was going to ask, people keep telling me that having the flu jab gives you flu. Is that true?
No, the vaccine that I'm going to give you, it's a non-live vaccine, so it can't actually give you flu. Sometimes what happens is people are incubating the disease, and it takes 1 to 3 days before you get flu, so you could be incubating it, and then before you have a chance for the vaccine to work, because the vaccine takes 2 weeks to work.
So I hear that when I had this done last time, it didn't hurt at all. So it's a very simple injection to have. It's relatively small. You just have it in the top of your arm.
Yeah, that's fine. It's a nice fine needle. Okay, you okay there?
Only joking. It doesn't hurt at all.
So if you just press on there, that's it. Okay. And would you like a plaster?
I would.
Yeah.
Thank you.
Okay.
Is that it? Are we all
That's
done?
it. I can hardly see where it was. You might be able to feel. Oh, there. I can just see there. That's it.
So it was as quick as that. Very simple. Very easy. Please get your flu jab today. Okay, so I have an update regarding the Monitor investigation. We're continuing to work closely with Monitor as part of the investigation into our financial governance and sustainability. We provided an update to Monitor about our progress in September, and whilst achieving the necessary savings continues to be an enormous challenge, we're making great progress, so thank you to all of you for your support. But we have got to maintain the momentum. The Monitor team will be here again in October to review how we're doing, and they're going to be asking some tough questions about our progress to date and our plans for achieving the outstanding savings. Many of you will be involved in these discussions, and we will of course let you know about the outcome. Monitor has also recognised that how the local health and social care system works can have a significant effect on our financial position. So they have facilitated the establishment of a new group that includes us, our commissioners, and will be chaired by NHS England to see what can be done collectively to balance our books now and for the future. Speaking of the future, we've been holding a series of workshops to involve you in reviewing the long list of possible options for the future configuration of our hospitals. The long list includes a wide range of options for how hospital services could be organised and provided in the future, and we need to reduce that list using the criteria that's been developed by a wide range of stakeholders that include our staff, our membership, the wider public, other professionals, to a much shorter list of feasible and realistic choices. Please come along to a workshop to hear about how the long list and shortlisting criteria was developed and have your say about the future options. The process will be completed towards the end of this month. Then we'll work up some more details on each of the shortlisted options. We'll be aiming to take the shortlist to formal public consultation in the new year. There's a programme called Healthier Lancashire, which involves health, social care and wellbeing services in Lancashire working together to develop a long-term strategy for our communities. The programme aims to create a healthier population and will focus on reducing health inequalities preventing ill health and designing services according to people's needs rather than organisational boundaries. We have been actively involved in developing this programme because we believe it's vital that all of the health and social care organisations need to work together to create a system that works for everyone, so that people can get the care they need when they need it in the right setting. And that will reduce pressure on our hospitals and help us focus on providing the specialist care that only we can. Healthier Lancashire is developing a blueprint for a different way of working and will be aiming to publish these ideas before the end of this year, so keep an eye out for developments. If you're interested in this work, Carol Spencer and Andy Curran are our leads. Get in touch with them for more information. In January, NHS England invited organisations and partnerships to apply to become Vanguard sites, which will pilot the implementation of new ways of providing care and services, as you will have seen in the 5-year forward view, and that sets out the future vision for the NHS. Together with East Lancashire, Morecambe Bay and Blackpool, we submitted a bid to form an acute care collaboration with the aim of linking our hospitals together to improve our clinical and financial viability. Unfortunately, our bid wasn't chosen as an official vanguard. However, we have decided to take forward our ideas to work collaboratively and collectively to make better use of our resources and deliver the very best care for people in Lancashire. By collaborating, we'll be able to reduce variation in quality of care for local people, reduce duplication, increase our purchasing power, and work together to provide 7-day services. This is a really exciting opportunity for us to do things differently, to work collaboratively, to pool resources and expertise, and to improve care for local people, as well as ensuring that we're all sustainable for the future. You'll hear more about this as the project unfolds, and I hope that you'll get involved. Now it's time to take a look at our performance figures. There were no avoidable cases of C. diff during September, which is a great achievement. However, we are 2 cases above our year-to-date trajectory for cases attributable to us as a hospital. Last month, we achieved our target for harm-free care in terms of things like pressure ulcers, blood clots, and inpatient falls. The initial figures also show that we achieved our target for the 4-hour standard for the emergency department in September, and we achieved 8 out of 9 cancer standards in September, which is an absolutely superb achievement. We've been focusing on prioritising treatment for patients who've been waiting for longer than 18 weeks. Now we're measured against something called the 18-week incomplete pathway standard, which we did manage to achieve in August. We've got to make sure that we continue to closely monitor progress and listing of all patients who've had long waits for procedures, and that we tackle any barriers to prevent further delays. In September, more than 91% of inpatients, day case patients, outpatients, and nearly 86% of people coming into ED said that they would recommend us to their friends and families, which is just absolutely fantastic. And now just a few other updates for you. The research team are currently recruiting staff who'd be interested in doing a clinical academic research internship. If you'd like to help make a difference and explore issues to improve patient care, why not find out more about taking part in a funded secondment? This opportunity is open to nurses, midwives, allied health professionals and healthcare professionals, and will run in partnership with the University of Central Lancashire. The team are holding drop-in sessions at Preston and Chorley, where you can go to find out more. Dyslexia Awareness Week has recently taken place, and we offer support to any of you who may be affected by dyslexia. We have a confidential support group for staff with dyslexia, and these meetings are held on a monthly basis. If you'd like to attend a meeting, please contact Barry Morgan. Recently, the Information Governance team have been asked about contract clauses and how to send emails securely. Well, guidance is available on the IG intranet page. The auditors will be visiting the Information Governance team over October and November to assess our IG toolkit. If you handle any patient identifiable information, you will need to make sure that you undertake your annual IG training. If you have done your training since the 1st of April, please forward the date that this was completed to the IG team. If you did it before the 1st of April, you will unfortunately need to resit your training immediately. And again, please forward the date that this was done to the IG team. Any questions, please contact them on the number below. And finally, a couple of months ago, we asked you for your views about Team Brief so that we can continuously improve communication. Hundreds of you completed our survey, so thank you very much for telling us what you think. The survey results show us that you like to receive Team Brief in a range of different formats, online, as a podcast, and as a printed copy. So we're going to carry on producing all of those. More than a fifth of you said you prefer your manager to deliver Team Brief in a meeting so that you can understand how things affect you and you can hear more about what's happening in your particular area. Having a team meeting is good practice. It creates a much more productive working environment and it increases staff satisfaction. So this is something that we're going to be working on improving in the coming year. You said the content's useful, but you want to hear more about the big picture, what's happening around the hospitals. So we'll make sure that we cover those aspects in future Team Briefs. You also said that you would like Team Brief to be more interactive. So we'll be linking Team Brief to valuing your voice and promoting how you can give us feedback or ask any questions every month. Valuing your voice is our framework for staff feedback, and you can email queries or views via the anonymous online form or send me a note. Staff do contact me regularly about a range of things, maybe something they've heard on the grapevine and they want a straight answer, or a suggestion for improving processes. So have a look at the recent posts. And please do get in touch if you have a view about Team Brief, you need something clarifying, or you have a good idea for improving how we work. So that's it for this month. Thank you to the team here at Occupational Health for giving me my flu jab today. Make sure you get yours, and I'll see you next month for an update.